They said I said, you know, my editor was getting that in the night. Hey. Yeah, they get a little jumpy. Video.
What was your what do you think that was designed?
Oh, it's for sitting. I use it in scrums.
Yeah, I see it. I've seen you with it, but do you think they were like thought
It's a
about
camping
you?
chair. It's a camping chair. If you go camping, yeah, that's what it is. It's a camping chair. So if you go on Amazon, just look up camping chair.
You can't do it under the breath.
Right.
Yeah,
Like Google out of it. If you go to Amazon and say waiting for CPC statement, chair. Camping
Eric
chair.
Holland's chair.
Right. Waiting for Rocco. Camping chair. Yeah, that's not.
Those are for like in the lobby at like 26 and Cal.
Yeah.
Or
See, I used to have a new but this was like, oh Not really. Moved up or eight.
oh yeah, you're right.
Yeah. Right.
The Lightfoot available? Is that just a one other sound?
Yeah.
Lightfoot.
I just know that she canceled.
So as recently as this one. Lightfoot was insisting.
March 30th.
No interviews, so while he was voting, he was talking about his platform. March 30th. It is, but it's my library. And then I think honestly, there's just like a conflict at the super site, so you don't need to vote for it. You don't need to access it. The super site. That's why the mayor says it's up.
The mayor's gonna look like all sheep.
Yeah. Like, I don't know if it would be also she was gonna bring it to like the street corner and this one and grab the back lunches and food. Yeah.
Yeah. Yeah.
Good afternoon, and thank you all for joining us today. As it's Friday, I want to reiterate to everyone that this is a daily press conference, meaning that these briefings will continue tomorrow and Sunday at 2:30 p.m. unless otherwise noted. Available live on on our Facebook page or at illinois.gov/live video. Last hour, the President declared a national emergency. This is an important step, and we will work to bring every resource available to us into this state, but make no mistake, we have long since passed the moment when we thought we could count on the federal government to lead in the face of this unprecedented situation. Here in Illinois, we are doing everything that we can to keep transmission rates as low as possible, to flatten the curve for our healthcare workers and our first responders, for our most vulnerable populations and our older citizens. And we're working with other states and with federal officials to ensure that our national mindset reflects those same priorities. It's with that in mind that I have determined that we will close all K-12 schools starting Tuesday, March 17th through March 30th. This is the timeline that we are laying out today. Let me be clear, I understand the gravity of this action and what it means for every community in our state, as well as the families and caretakers of the 2 million students that gather in large groups every day in school classrooms and assemblies. None of the choices that we have to make over the last week, or have had to make over the last week, have been easy or simple. All of these choices have cascading effects for citizens and vulnerable populations when it comes to food access and safety, childcare, and social services. It's my job to weigh the benefits and risks of any one particular course of action and to come to the best possible conclusion. This is the right thing to do, to protect our students and their teachers and school workers and parents. The Illinois State Board of Education will be fully staffed over the coming weekend and during the closure period to help district administrators work through individualized issues and challenges in each community. The Illinois Association of School Administrators is convening a team of experienced superintendents across the state to serve as a resource and as a conduit to my administration for issues that arise as a result of this directive. I want to thank the superintendents, the ones that are standing with me today and all across the state. Dr. Courtney Orzel of Lamont Brombarrack School District 113A, standing with me. Dr. Kimako Patterson of Prairie Hills School District 144. Dr. Brian Harris of Barrington District 220. And Dr. Mike Lubelfeld, North Shore School District 112, and superintendents across the state for their courageous leadership during these difficult times. Our State Superintendent, Dr. Carmen Ayala, is here today to talk more about this decision and our plans to remove certain state mandates during this period in order to offer more flexibility. Let me be clear. No school district will see their state funding cut as a result of this public health crisis. I want to address the first consequence that will come to mind for so many: food access. Our State Board of Education has received the necessary waivers to continue to distribute 2 meals a day to children who qualify for free and reduced lunch through a combination of delivery and parent pickup meal options. ISB is working with local school districts across the state to develop guidelines on how to best distribute meals across the community in a safe and healthy manner. We're also working directly with the 8 major food banks across the state, as well as food manufacturers, to ramp up capacity to serve our most vulnerable children. I know a lot of people are wondering, why schools? when we know that children seem to be less susceptible to COVID-19 than other populations. But this is a critical part of our larger social distancing efforts. In addition to kids with immunocompromised conditions, we have teachers and administrators, parents, and the larger population to consider. I'm speaking in the very literal sense when I say that having the general public stay home one day at a time will have a massive effect on bending this curve, and that means lives saved. We have seen positive results in countries that took aggressive action, and we have seen the tragic outcomes in countries that did not. There are things that you can do to assist your neighbors and your friends and your family. The people of Illinois are a creative and generous and caring people, and I'm asking everyone to help in these challenging circumstances. So please, this weekend, if you can, stay home. If you are able to telework, do so. If you don't have to travel, don't. This isn't forever. This is a sacrifice in the short term to help our hospitals, our healthcare workers, our testing laboratories, and our vulnerable and elderly residents. We all have a duty to each of them. Everyone will make a sacrifice, but of course these sacrifices run deeper for some residents more than others. I'm working to do everything I can to help our working families during this unprecedented national crisis. Already we've filed emergency rules granting workers who are unemployed due to COVID-19 access to unemployment benefits. I'm reaching out to the heads of all utility companies around the state to maintain services to the fullest of their ability to pay. Additionally, in collaboration with Attorney General Kwame Raoul, I have requested the Illinois Commerce Commission initiate an emergency proceeding on a moratorium on shutoffs and changes to payment and collection policies to ensure that Illinoisans aren't saddled with debt if they're unable to pay their bills during this crisis. I'm continuing to press the federal government to massively scale up our testing capacity as a nation. Here in Illinois, our Department of Public Health and our hospital partners have developed a robust testing capability and are ramping up to sufficiently test weekly to accurately surveil our state population. But we need the federal government to step up and provide the necessary support for that effort. On that note, I want to be very clear. Not everyone is going to need a test. We have to prioritize those who are sick enough for the hospital and our elderly residents and individuals who are otherwise immunocompromised. We will all be better off if our healthcare workers have first access to those tests and to all personal protective equipment. Please leave the masks for those who need them. It'll protect you more in the long run. I know this is hard. I know people are scared. But most have never dealt with anything like this before, and it's easy to let rumors take hold and let fear drive us. I will continue to be fully honest and transparent with you. Every action that we take to control the spread of the virus and prevent our medical infrastructure from dealing with too many cases at once is an action that impacts and disrupts lives. And all of the evidence that medical experts have provided us is that even 24 hours can make a difference when it comes to the timing of these decisions. I will not have us look back after we are through the immediate challenges and say that we didn't take action soon enough. I will leave nothing on the table when it comes to protecting our communities. We've seen what happens in places that didn't move quickly enough. I ask all of you not to hesitate to do the right thing for your family, your friends, and your community. One small step at a time. We will get through this together. Thank you, and now I'd like to introduce our State Superintendent, Dr. Carmen Ayala.
Good afternoon. To Illinois students, families, and educators, the Illinois State Board of Education is here and ready to support you. This is an unprecedented event in our lifetime. I want to thank you personally for your extraordinary leadership during a time of very difficult decisions to all of our leaders across the state. Having been a former Illinois State District Superintendent, I know every district is unique, and closing schools will affect each of your communities differently. The Illinois State Board of Education stands ready to help you. We're here to be a resource, to troubleshoot, to offer you guidance, to answer your questions as best we can, and ultimately to get through this together. Most importantly, we want to continue to meet our students' most basic needs, and as you heard, we are working with school districts to ensure that children who rely on schools for nutrition can continue to receive free breakfast and lunch every day. We have asked that school districts provide some continuity of education while schools are closed, like the types of activities students might be doing during spring or winter breaks. On our website, you will find links to some free online resources to help your children continue learning. Each school district has the full autonomy to provide learning opportunities in the best way that meets your students' needs and is possible in particular circumstances. We encourage you to implement what works best for your school community. To protect students' safety as well as their health, we have asked that at least one administrator stay on site during regular school hours in case children whose parents cannot be home or children experiencing homelessness need a safe place to go. This is a scary time, but please know that we are here to do anything and everything we can to help our schools and our students get through this crisis. Thank you.
Go ahead.
Sorry. I'd like to introduce Dr. Ezike, the Director of the Illinois Department of Public Health.
Thank you, Dr. Ayala. So today we are announcing an additional 14 cases. All but one are in the Chicago-Cook County area. We have one case in Lake County. Public health officials are investigating any travel history or exposure to known COVID cases, and additional information will be shared later. As has been said, we are in extraordinary times as we see the reports around the world, and here at home, we see the situation is rapidly evolving. The state is taking aggressive measures to help limit the spread of the virus as the number of positive cases increase exponentially. We want to get ahead of widespread community transmission to reduce the number of people affected. Again, we would rather be overcautious than put the health of our most vulnerable citizens at risk. Please understand that none of these decisions were taken lightly. The governor's office, IDPH, all the state agencies, and our local community entities have all been working closely throughout this response. Initial steps to prevent illness that we have been talking about from the beginning still apply. They should still be practiced. Hand washing for 20 seconds. Everyone is realizing how long 20 seconds is now. Staying home when you're sick. Disinfecting frequently touched surfaces. If you haven't received your flu shot, I still urge you to get your flu shot. However, we are moving into community-level actions, and that includes limiting large events and mass gatherings and temporarily closing schools. We have seen evidence from influenza outbreaks that community mitigation strategies, such as school closures, will have an effect on decreasing the severity of the outbreak. A systematic review conducted in 2013 on school closures for influenza found compelling evidence that school closures could reduce influenza transmission. To update the evidence, additional studies were conducted in primary and secondary schools. And overall, the findings from the updated systematic review supported the conclusions from the 2013 data. Looking back 100 years to the 1918 pandemic flu, 13 studies investigated preemptive school closures, in which schools were closed with the aim of slowing transmission in the community. And the analysis estimated that early and sustained interventions reduced mortality rates up to 25%. Some studies estimated that waiting to close schools didn't result in reducing the total attack rate and duration of school outbreaks and the spread of influenza. Information from other countries has also shown that the virus causes more severe illness in older individuals. Younger adults, including children, may not suffer severe illness, but they could unknowingly pass the virus to someone who is more susceptible to complications. Closing schools will not only help the students and the teachers that are over them, but also help reduce spread of the virus on a larger scale, as it takes one community setting out of the equation. By taking these actions now, we really hope to slow and limit widespread transmission, which is essential to ensuring our healthcare system is not overwhelmed as the disease progresses through our state. We also need residents to continue to help with the response. We are trying to reserve our resources, such as the governor mentioned, our protective gear, gloves, and masks. Save those for the healthcare workers who are on the front lines, who are at the greatest risk of infection, and who need to continue working through this situation. We do need to emphasize that there are a limited number of tests available. So we do ask that people who do not have symptoms or have mild symptoms stay home. We're trying to prioritize those tests for individuals who are at the highest risk for severe illness. Like it or not, this virus is here in Illinois, and it will continue to spread. We will continue to have increasing numbers of cases, but we want to minimize the severity of illnesses and deaths associated with it. If we can decrease the rate at which we are seeing new infections, fewer people will be ill at the same time, which will help us to prevent the overwhelming of our healthcare system. We want to be in a position to be able to take care of our sickest residents and be able to hospitalize and give the advanced level care that each individual needs. We think that school closures will help us achieve this, and so we're asking for everyone's help and support in this effort. If you have general questions about COVID-19, I still refer you to our website at dph.illinois.gov. Our hotline is at 1-800-889-3931. Again, we are asking that everyone do their part to limit the spread and protect those who are at highest risk of infection by staying home and limiting going out. Again, it's worth mentioning, we know the difficulty of these measures. As the governor said, we would rather at the end of this be criticized for doing too much. It will be very hard to live with being told you didn't do enough to protect the people of Illinois. Thank you. And with that, I will turn it over to Chairman Cronin. He's the chairman of the Dupage County Board.
Thank you, Doctor. Today I join the governor, who has taken most prudent action possible to minimize the impact of the COVID-19 virus on our community. It is not an easy decision to temporarily suspend classes throughout the entire state. However, taking serious, thoughtful action based on the best public health guidance and science available to us is the wisest course of action and the best path forward. We must recognize, and I'd like to recognize the Dupage Public Health Department, healthcare partners across the county and the suburban areas and hospitals whose efforts have been exceptional. Thank you to those healthcare workers serving our most vulnerable population in nursing homes and long-term care facilities. As we enter this next phase of our response, it will be critical for us to work together to minimize the spread of COVID-19 using the best information we have. So at this point, the governor will take some questions.
Governor, what has
Thank you,
changed?
Mr. Chairman.
24 hours? Well, since this morning, not even 24
Same
hours.
question, yeah. Yeah, so you know that we've been day by day monitoring all of the changes, all of the new information that's been revealed. There's a kind of a wave and a weight of evidence, I guess, that we're weighing every day about all of these issues, whether to limit the number of people who gather, whether we ought to set it at 100 people, or as happened in Rockford, 25 people, 250 people, or 1,000. Whether to allow schools to meet and to set guidelines on whether schools should have meetings but not assemblies. We weigh these things every day, and we know what the consequences are of closing public schools and private schools. And so, it's the weight of the evidence here in the end. And I would say, number one, what we're seeing is across the country that the scientists and the doctors who are advising all of us who lead states are basically coming to the conclusion that social distancing is the right answer, and that we need to make sure that we're protecting not just our elderly, but also all of our adults and all of our children, and separating people so that there isn't a young person that happened to be transmitting to an older person because they're in school together. So that's something that we were weighing, and I made a number of calls as I was contemplating this. We're now, I think, the 8th state to close our schools. Los Angeles, as you know, has closed its schools, Michigan, and so on. And I looked at all of that. I made calls to some of the governors who've made those decisions to listen to what evidence they're looking at. And I came to the conclusion in the end, in consultation with superintendents, in consultation with the mayor, in consultation with others across the state, that this is the right answer. Let me add one more thing. Hundreds of thousands of students are already out of school because their school districts chose to close. I think the number is up to about 280,000 now, students who are out of school because their school districts chose to make the decision not to meet. And so looking at that, looking at the other evidence, the scientific evidence, I came to the conclusion this is the right thing to do.
Why have school on Monday then?
Yeah.
And also, where is the mayor? Is she on board with this? Why is she not here, and why is the city public health director not here?
I've been in consultation all day. They're quite busy also figuring out all of the things that they'll need to be doing, as will many of the people standing behind me figuring out all the steps that will need to be taken in their various districts. And there's an understanding here that we need to protect families and communities. That's really what this is about. It's protecting entire communities from what could happen as a result of the schools actually getting back together. You asked about why Monday. Yeah, we wanted to make sure, when you make this decision, you don't make it lightly. And one of the things that school districts are concerned about is if you're sending kids home, will they have lesson plans? Will they have e-learning? Some schools have e-learning. Some kids have available to them internet. Others don't. And so we wanted to make sure that the teachers were able to get lesson plans put together over the weekend, whether they're online or offline, and get together with their kids to explain to them the work that they could do over the next 2 weeks when they're not in session together, that they might do either online or just on paper.
How are kids going to still get this breakfast and lunch that you speak of?
So we've been working very hard on that, and as you know, Chicago Public Schools, for example, in the fall, as a result of the strike over a couple of weeks, they were delivering meals to neighborhoods. That's one example. We will be working very hard to deliver meals to neighborhoods, particularly to the kids, either directly at their homes or in locations where they can pick it up. We've been working on that. We'll be working on that all weekend and all through Monday until kids are out of school. It's very important to me. This is one of the big considerations, frankly, when you talk about closing schools, not just about Chicago. This is true all across our state. I mean, we have a very large population of kids who are on the free lunch program or reduced rate lunch program. So we want to, these are kids who sometimes don't get another meal in the day. So we want to make sure we're delivering those meals so they can access them.
How will you determine whether or not to reopen schools at the end of the month?
Well, 2 weeks. Look, we're going to look at every day. To be honest with you, we are looking at all the evidence of what more should we be doing. Can we alter the way we're handling things? Because this is all about safety and health of the people of Illinois. So we'll be looking at the evidence. We'll see, by the way, school districts across the country have chosen to do this. We'll be seeing whether the incidences are curving the right way. Even over the next 2 weeks, there will be people who choose to self-isolate and so on as a result of the decision that we made here. And we'll make another decision, like we have every day. Every day, I hate to say in this situation, this very challenging situation, every day is a new day. I was going to say we wake up to something new, but honestly, we're working all night long. And the truth is that we get new information every day because there's so much we don't know. And so we'll be making this decision, frankly, every day through the 2 weeks. If we could go back into school earlier, we'll choose to do that. But as we approach the end of this 2-week period, we'll make a decision. But I think that 2 weeks is the right time.
Governor Rose, I just wanted to be clear.
Yes.
Was it your impression after talking with Mayor Lightfoot that she was on board with this completely, or what?
Yeah, I think, look, these are hard decisions to make, and it isn't like, you call somebody up, any of the people behind me. It's not like, you wake up and think, today, this is the day we're going to do it. You're always weighing these things, and again, it's a 60-40, 70-30 kind of decision. There's always some downside to making a decision, but there are tough decisions to be made, and as you know, the mayor is not immune to making tough decisions. Neither am I, and so we work collaboratively. We talked, at least several times, maybe half a dozen times during the course of the day, starting early this morning.
Just parents are prepared, though, in Seattle, where obviously the situation is much worse than here. They have closed schools through the end of April.
Yeah.
Should parents, you said you want to be transparent, should parents be prepared that schools here could stay closed into April if the cases continue to climb, even if it's not the huge boom you're trying to prevent? If we're still seeing cases, should parents be prepared for something like that?
Look, this is unprecedented, so it's very difficult to give guidance about something in the future that you're asking about. I don't think that I would tell parents to prepare necessarily for a very lengthy time period out of school. On the other hand, I would say to parents, they should be monitoring this every day. They should go to the IDPH website. They should be listening in on these broadcasts. They should be listening mostly to our healthcare professionals. And we'll be making decisions as we go, but as of now, we think this is the right period of time.
Do districts have to pay all their staff?
I'm sorry,
Do districts have to pay all their staff, including hourly staff, bus drivers, cafeteria workers, things like that during this time off? What about daycare centers?
Maybe I could turn it over to Carmen. Sorry, Dr. Ayala, would you mind answering that question about school districts? I think it'll be different in different places.
Specifically for school districts, these days would be classified as Act of God days. And so attendance really isn't impacted. It's like a normal working day. And so the preliminary information that we're looking at is that school personnel would continue to be paid during the Act of God days and the emergency days.
Governor, was there a specific piece of evidence? I know you said that this is evolving, but yesterday, both you and the mayor, even this morning, they were very adamant about the schools not closing. We're not there yet. And is there a specific piece of evidence that you've heard to make you make this decision?
Well, I said to you yesterday that I said, I was asked, are you going to close schools? And I said, no, but this is a day-to-day consideration. And yes, it's true that, after that press conference, as I began to look at more evidence that was coming in over the course of the evening and overnight and this morning, and contemplating as well, having made the decisions that we made already about limiting gatherings, I started to think about the kids who will go to school and who may, in fact, end up going home and bringing it home to their parents or grandparents. And I really came to the conclusion that, we're telling adults, essentially, don't gather in large groups, but we're telling kids, that you can bump up against each other in a hallway, even if you might not have an assembly. And so, that was one of the considerations. I also was reading a lot of the new information coming out of Italy, and I'm very concerned. I'm very concerned about flattening this curve. And I think this is the right thing to do. We're all focused on getting past this situation, this circumstance. And I think this is a short-term measure that will help us also alleviate the burden on our healthcare workers and our hospitals, because we're going to see more cases. You just heard Dr. Ezike say there were 14 new cases today, and I think you're going to see it in a press release if you haven't already, those cases. But remember that just a few days ago we had 4 and then 8, 6, 14. I mean, we're now in the 40s of cases, and as you look at other countries and you look at other states in the United States and the curve that they're on, we need to do a lot more. And so I just came to the conclusion, the weight of all that evidence, we need to flatten the curve more.
What about Daycare Centers?
Do you have a short, concise message for the people who are still saying this is overblown, everyone's overreacting?
I know that there are communities across the state where there is no one that has COVID-19. Your community is not immune. We have seen this across the world. This came to the United States later than it did to other places. And because the federal government didn't come up with enough tests, we cannot constrain this virus in the places where it has been an outbreak. And the result of that is we have community spread. Once you have community spread, it has the ability to go anywhere. So I know there are people that live in central Illinois right now who feel like, well, gee, nothing's hit my town or my county. Unfortunately, everybody is susceptible. And so we should all be on the same page here. This is coming. It's here. We're going to have to live with it for a while. There is no vaccine yet. There is not even a direct treatment that has been developed. And we don't even have enough tests yet. So let's get ahead of this thing. Let's do the right thing. This is the right thing today.
Daycare centers and any new consideration for mass transit.
Yep, thank you. There's no new consideration right now around mass transit, but I will tell you about daycare centers that, number one, we're working on expanding childcare availability. We're also giving guidance to those childcare facilities. Again, those are very small groups typically in childcare centers, but we are giving guidance, and we're importantly trying to expand unemployment benefits for people who say, listen, I need to be home with my child. And so we're working hard at the federal government level. You know that there's a piece of legislation that's working its way through this afternoon. Hopefully it may have passed while we're standing here, but hopefully by the end of the evening it will. That will help us with our unemployment benefit challenge so that we can offer that to everybody. We are going to offer benefits. But the federal government has a bill that will expand those benefits and open up health care for a lot of people who might otherwise not get it. This gentleman right here.
When do you know?
Get an update on the conditions of the people with cases or any vacation?
Sure. Yep.
I think as the numbers increase, we're focusing on the population as a whole. I still will say that, the people who we have been talking about and the ones that we've added today we have the one that we've talked about who has been in critical condition. There's no change. I think we're going to probably get away from getting into individual as the numbers grow, but it's affecting all ages. Most of the people are going to fare well. We are there's a higher risk for those who are older and that have pre-existing medical conditions, and those are the people that we are really going to be focusing on them not getting the infection in the first place. So that's why all of these strategies are necessary. Thank you.
Can I just, this gentleman, I'm sorry, asked me to answer. Yes, sir, right there.
Illinois getting more tests?
Yeah.
You were talking about not enough tests.
I have been asking that question every single day of the federal government. I'm not going to stop asking it. We don't know, and it's because they didn't plan well enough. Here's what I will tell you, though. I met with many of the hospital leaders in the state of Illinois. Many of those hospitals or research centers are developing or have already developed their own test, and they are going through rapid FDA approval processes that now the federal government is allowing. So we will be able to expand the tests. They're homegrown, meaning that we made them here in Illinois, but these are some of the greatest medical institutions in the country, and they've developed tests that work. And so we'll have at least more that are available, but still not enough. The federal government needs to step up. Thank you.